superhero aerial dots. The YouTube link will be shared in the chat box, so feel free to go back and watch it if you missed it, and also share with others on social media if you can. So again, thank you for joining us for the Community Conversation panel. My name is Tarnika Manning, and I'm the Administrative Director overseeing the Office of Equity and Minority Health at the Robert H. Lurie Comprehensive Cancer Center at Northwestern University. And I'm pleased to be here to moderate this session. It's great to be a part of this session where a lot of these people are my friends, actually, and been working with for many, many, many years. So I'm just eager to really get into the conversation and learn a little bit more about the people who are actually doing the work on the ground. So before we get started, we do have Spanish translation available for this session. So I would like to bring on our interpreters, Emmanuel Zambrano and Griselda Garibay, who will tell you a little bit more about the instructions to receive the translations.
Good afternoon, everyone. It's a pleasure to be here. My name is Griselda Garibay, and I will be, along with Emmanuel, assisting those of you that need support in Spanish. Un par de guías, por favor, como verán aquí en la presentación. Vamos a ayudarles en cuanto a interpretación en español. Por favor, de marcar por tu teléfono el número 571-317-3116 y marcar el código de acceso, el 546-076-933 y el signo de numeral. Por favor, para que todos podamos disfrutar de esto apropiadamente, silencie su computador u otro dispositivo en el que esté viendo el foro. Escuche el audio del foro a través de la línea telefónica. Así que también le podré decir que no tan solo soy parte del Comité de Diversidad de la Sociedad Americana de Cáncer, pero también estoy celebrando mis 5 años en remisión como sobreviviente de cáncer de seno. So I would just like to add briefly that not only am I really engaged and honored to be part of the Diversity and Equity Committee for the American Cancer Society, but I am celebrating this week my 5 years as in remission from breast cancer. So now, thank you. Yes, it's definitely something important. But Emmanuel, please.
Thank you, Griselda, and congratulations to you. I'm really happy to hear that you reached the 5 years mark as a survivor, breast cancer survivor. So we're really happy, and I'm going to be helping Griselda as an interpreter to our Spanish audience. We are really happy to have today. I'm going to switch now into Spanish to introduce myself to this group. Mi nombre es Emmanuel Zambrano y trabajo para la Sociedad Americana contra el Cáncer. Muchísimas gracias por estar la tarde de hoy. Sí, y gracias por estar ahí pegado a la computadora, viendo y participando en este foro. Ya las instrucciones para usar el audio las tienen en pantalla. Griselda las compartió con ustedes, pero no duden, si tienen preguntas, no se queden con la pregunta, háganla a través del chat, enfrente de su pantalla, al lado de la parte derecha del video, o solamente por el audio o la línea telefónica. Gracias. Thank you very much, Tarnika. And with this, I'm gonna pass it to you.
Thank you, Emmanuel and Griselda, and congratulations, Griselda. That's a wonderful celebration to recognize. All right, so before we get started, we have a couple housekeeping items that we want to go over. So please make sure you keep yourself muted to eliminate any background noises and any distractions. To spotlight our speakers, we recommend you click on the view icon in the upper right corner of your screen and click on speaker. We will be taking audience questions, so feel free to add any questions that you have throughout the session in the chat box, and we will be looking for any of your questions throughout the session to ask our panelists. All right, so let's get started. This afternoon, we are joined by panelists from community organizations and health systems who are doing vital work in their communities to address and eliminate cancer disparities. Please give a warm welcome to each of our panelists, who I invite to introduce themselves and give a brief overview of their work. So let's start with Aaliyah Graham, who's with Sisters Working It Out.
Good afternoon, all. Thank you for having us here on this platform. It's been such a pleasure working with you guys. You guys are so super organized, so I appreciate that as well. Sisters Working It Out is a nonprofit organization based here in Chicago, and our goal is to aid in the advancement of breast cancer awareness throughout our community. We you mentioned earlier that we are targeted for African-American women, but we don't discriminate. So if there is a woman in need of help we provide rides to chemotherapy, doctor's appointments, whatever it is you may need. We also partner with other organizations to assist in that. But our goal is to smash those stereotypical things about African Americans and their fear of taking care of themselves and doctors in general. So we want to educate and serve in the community and let them know that cancer is, while it's a deadly disease, there are so many advancements that the numbers are in fact shifting. So our goal is to make sure that our community is aware of that and to aid in any possible information that we may have and relay that information throughout our community.
Excellent. All right.
Oh, I'm sorry. I'm the director of programming for Sisters Working It Out, and our CEO is on the line too, but she's not going to be speaking. So I'm sorry. I was supposed to
Hi,
be.
Beulah. I think we're just among friends, and you just everyone already knew what you were doing. So, all right. So moving on to another good friend, Donna Lynn Schaefer from Equal Hope. Tell us a little bit about yourself and Equal Hope.
Good afternoon, everyone. My name is Donna Lynn Schaefer. I am from the organization Equal Hope. Equal Hope is a patient navigation service that we provide to all uninsured women throughout now, because Equal Hope has expanded our services, any uninsured person in the community can get services from Equal Hope. We provide free mammogram screenings, cervical cancer screens, as well as medical home placement. I've been with Equal Hope in March of 2022. It'll be 10 years. I'm usually boots to the ground outside, educating our sisters in our community on the importance of early detection. Early detection is key in saving your life due to breast cancer. So Tanika and ACS, thank you guys so much for allowing me to be a part of the panel today.
Awesome. It feels like you've been doing this forever, Donna Lynn. Like, you've been out on the street and usually in the background, so it's nice to have you in the forefront.
Yeah, it has been.
All right. Our next
I don't
panelist.
mind being in the background. I don't mind being boots to the ground.
All right. Our next panelist, Dr. Dario Velmier from the University of Chicago. And he is going to tell us a little bit about Lucero.
Hi, good afternoon. My name is Dr. Dario Velmier. I'm a hematology oncology fellow at the University of Chicago. I'm interested in taking care of breast cancer patients, as well as patients with genitourinary cancers, and also have a research interest in community engagement interest in kind of decreasing health disparities in cancer, particularly in increasing minority participation in cancer clinical trials, and kind of overall increasing our engagement at the University of Chicago with not just our neighboring Hyde Park community, but also with the Latino community within our catchment area. So with that goal in mind, I'm part of the group called Lucero, which stands for Latinos United for Cancer Education, Research, and Outreach. This is kind of a rebranding from an initial Latino Cancer Control Task Force that was created in 2019 as part of kind of the Office of Community Engagement in the Cancer Center. So as the name implies, we are involved in education efforts kind of in the community. A lot of this is led by Erica Rodriguez, who's on the call right now. So she runs a lot of educational sessions with members of the community in terms of kind of raising awareness for particular cancer month. So for example, last month we had several events to raise awareness on breast cancer. This month we hope to have events raising awareness on lung cancer and potentially on pancreatic cancer. From a research side, which I'll talk about a little bit after, I've been working on creating a needs assessment survey in the Latino community to figure out ways in which we can kind of increase our engagement with the Latino community and therefore kind of ultimately maybe boost our the numbers of minority patients that enroll into our cancer clinical trials. In terms of outreach, we're always in the community. We're out in health fairs and kind of different community health events. So happy to be a part of the panel today and eager to see what everybody else is doing as well.
I'm very eager to learn more too. It seems like you all doing a really nice job connecting to the Latino community on the South Side. So looking forward to hear more about that. All right, our next panelist is Faith Neong from Amita Health. Can you introduce yourself and tell us a little bit about what you're doing out in the community?
Thank you so much. It's a pleasure to be here. Thank you for having me. So my name is Faith Neong, and Amita Mercy Medical Center in Aurora, Illinois, actually sends me into the African-American faith community to promote health and wellness. So that's what I do all the time. So particularly in October and really throughout the end of the year, we really focus on breast cancer initiatives. And that's just encouraging and giving people the tools that they need to get screened. So it's very exciting, and we do a lot of grassroots efforts to get everyone involved and raise breast cancer awareness. So thank you for having me.
Thank you for being part of this. All right, our next two panelists are with the Northwestern Chinatown Patient Navigation Program. And we have Ivy Leong and Anna Young, who are going to tell us a little about what they're doing in Chinatown.
Hi, my name is Ivy Leong. I am a clinical research project manager at Center for Health Equity Transition. So I was a patient navigator, and I've been managing the Chinatown Patient Navigation Program since it started in 2013. I will let Anna tell you a little bit more about the program.
Yeah, so as Ivy mentioned, we're both research staff from the Chinatown Patient Navigation Program, which essentially provides cancer patient navigation services to address a multitude of complex linguistic, cultural, and socioeconomic barriers faced by residents living in the Chicago Greater Chinatown area, which is commonly known as an invisible community that includes many low-income, uninsured, and underinsured individuals. Many are first-generation immigrants, have low English proficiency, and have amongst the lowest cancer screening rates of all ethnic groups. Just to introduce a bit of our first program, which is also known as PN 1.0, as Ivy said, it launched in 2013 and has successfully navigated over 750 Chinese women through breast and cervical cancer screening, follow-up, and treatment. We achieve this by providing culturally competent care coordination, health education, as well as interpretation services. And not only do we significantly improve screening rates, follow-up, and treatment adherence, as well as levels of patient satisfaction of their treatment, PN 1.0 also significantly increased the trust between the Chinatown community and healthcare providers, as well as setting the stage for strong collaborative relationships across various clinical networks, social service community organizations, and just generally the overall Chinatown community. Building on the successes of our last program, we are currently doing a 2.0 iteration that extends our patient demographic to all genders and all cancers, with an aim of comparing the traditional one-on-one patient navigation model to a remote checklist-based strategy. And so the results of this study, which aims to recruit around another 600 adults, would be important in comparing the effectiveness of patient navigation models to possible alternatives that may be more scalable and thus widely implemented. And so in other words, we're essentially hoping to find a sustainable patient navigation model through this research approach that can be a part of standard of care for cancer patients, particularly for medically underserved populations.
Thank you, Ivy and Anna. So we want to go ahead and get into the panels and really give some good questions to our panelists. At any point, if you have a question, feel free to use our chat box to ask the question. We already do have a question in the chat box asking our panelists to put their name and organization within the chat box so that they'll know who's here. And also, if you can, go ahead and put your website too, because I think that's a great resource to share with our audience. So let's go ahead and get started with Aaliyah. All right, so we talked about this a little bit before the call started that, you know, majority of the population that Sisters Working It Out serves is African-American women, but you made it clear that you all do not discriminate. You're welcoming to all folks. But knowing that, that majority of folks that you're serving are African-American women or minority women, how important is it to have an organization that is led by Black women be targeted to Black women or minorities?
So forgive me if I am a little too transparent. Sometimes my transparency can be uncomfortable for other people. But what better way to know what's going on in the Black community than to hire a Black person to navigate through that community. So even as I think the smartest move that our CEO made was hiring both an African-American woman as well as a survivor of breast cancer. So I know personally what's needed for women who may be going through breast cancer. And while all of the diagnosis and all of the information that we give may differ, just mental support, just knowing that there's an organization out here that wants to be compassionate towards your situation. And as far as myself personally, there tends to be barriers when it comes to diversity and I just my personal opinion, not the opinion of SWIO. If we don't talk about it like it's a real thing, then how can we heal and be, you know, how can we level the playing fields of equality if we're not even, if we're uncomfortable to say, you know, Black women need this and white women need that. But just having that double minority, being a woman, being an African-American, and being a survivor of breast cancer, what better way to go out into the community and let people know, hey, we are here for you. So that is one of the reasons I believe that our CEO reached out to me. And in all honesty, she pursued me for a year. That's how important and adamant she was about making sure that African-American women knew that, you know, SWIO is, our goal is to be dedicated to the advancements of folks who are going through things. And unfortunately, in our communities, we don't always share our sicknesses. We don't always say, you know, I have breast cancer. I don't know what to do. And this could be every community. I can only speak about mine, but we'll bring ourselves into a shell and suffer through things on our own. But SWIO definitely wants you to know we're compassionate to your situation. We're here to help.
Oh, okay. I can go take another one from the.
If you can you make sure that your microphone is muted?
Are you?
All right, Aaliyah, another question, because I don't know if people know this, but Sisters Working Out is driven very strongly by volunteers. So people are giving their time, donating it for free, no asking for nothing, because they understand the importance of this and very passionate about the topic. But so how do you identify and train community volunteers to engage in community members and raise awareness within various communities?
Well, we do have an extensive community health workers training that we are actually in the process of doing every Thursday. Our next class won't start until after the new year, but our goal is to make sure that, first off, a lot of our volunteers are survivors themselves. So again, they understand and are compassionate towards the situation of folks who are battling breast cancer. But we want to make sure that they understand that there is a certain level of sensitivity when it comes to approaching people about their medical history or their medical conditions. So we do give them a training to let them know how, and again, it's called a community health workers training. Our volunteers, they are just as passionate as we are. So we don't want to send them out there blindly and just go help, but you go help and then you're doing it all wrong. So we do believe in properly training our volunteers to make sure that they are aware of what's needed by a patient aspect.
Thank you. And I don't know if anyone was able to see, but Aaliyah did share her information and website. So feel free to click on the website and learn more. Can people volunteer on the website?
You have to sign up. We don't have a new training class. Yes. Email me. I'll put my email in the chat. We're not turning away any volunteers because people need people. So
awesome. All right, let's move on to Donna Lynn. Hi, Donna Lynn. All right, so Equal Hope has recognized the importance of the medical home.
Hi, everybody.
How do you communicate the message of the importance of medical homes that you are working with?
Well, with Equal Hope, as most of you know, we were formerly the Metropolitan Chicago Breast Cancer Task Force, starting back in 2008. But what we've recognized over the years is that having healthy breasts is not enough. There's way too much going on out there. We also recognize that a lot of our community utilizes the emergency room as their primary care doctor. But what we know from emergency room use is that you can go there and get patched up. And what they're going to tell you when you're leaving, along with giving you a bill, is they're going to tell you to go and see your regular doctor, which most people who do not have health insurance don't have. And so what Equal Hope has done is we've created partnerships with federally qualified health centers throughout the city of Chicago and the suburbs for our community. And what we do with that program, which is called our Medical Home Project, what we do for our community is that we pay for their first visit. So Tarnika, when I'm outside talking to my community, I stress to them how important it is for us to have a doctor that we can see on a regular basis rather than waiting. Number one, waiting until our pain is so bad that we have to go to an emergency room where we really get no results, and paying a bill that we're obviously going to get from the emergency room, so that we here at Equal Hope can take someone from the community without any health insurance and schedule them with one of our federally qualified health centers and pay for their first visit. That's so important, because even if you're not ailing from anything at this time, to say that you can go and get an annual wellness visit to address some of these issues before they become chronic, such as diabetes, high blood pressure. We want to make sure that we're getting to you before these things become chronic, or before you stroke out, or you have to get an amputation because your blood sugars have been so high for so many years and you never knew it. And so what we've done again is made those partnerships, created a way that we can pay for your first visit, and then we've negotiated with our partners, hey, can you see them after this annual wellness visit? May you be able to see our clients on a sliding scale fee. We're hoping that that sliding scale fee would be no more than $25, $35 per visit. Again, this gives our community a way of seeing a doctor without incurring high fees and having a permanent medical home where you can go and see a doctor at low cost or no cost. In some of our situations, it's no cost. And so again, over this past 18 months, we've really working very hard outside to let our community know that this particular program is available not only to women, but also available to our men in the community. Because some of our men in the community, I would say a majority of our men in the community don't have health insurance. And we know that when you don't have health insurance, you won't go see a doctor. Our men tend not to see a doctor when they do have health insurance. So we want to stress the importance of having this program available to the community. So again, we can address these chronic illnesses before they become a problem, before you end up in the hospital, before you end up in the emergency room. We want to address these issues.
Awesome. So I didn't know that you all pay for the first visit. That's actually pretty awesome. You mentioned that you make it easy for people to.
Yes, ma'am. That's the best part about the program.
Well, yeah, there's other things I know you all do to help your clients reduce the barriers into care. So can you tell us a little bit about that too?
So here at Equal Hope, we have a wonderful staff team of navigators. Patient navigation is very important when it comes to our community, because we know oftentimes, more than not, that we as women, Black women, will put ourselves on the back burner to take care of everybody else. So with our programs here at Equal Hope, our free mammogram screenings, our free cervical cancer screening, and the medical home placement, Our navigators will navigate you through the entire process. So when I'm outside and I see people, I say sign up and show up. The reason I say that is because I know that my team of navigators is going to take you, schedule your appointment, remind you of your appointment, get your films if you have prior films, get your slides if you have prior slides for your PAPs. And also our team will go to an appointment with you. We provide bus pass if you need a bus pass. We have a nurse navigator for anybody who has an abnormal screening. Our nurse navigator picks up from that point and steps them through the process of diagnostics, even all the way through treatment. Our team will take you to your appointment. We do whatever we can to make this easy for you. And as far as removing barriers, our teams knock all those barriers down. So there's no reason why you shouldn't be able to go to an appointment, because again, our staff of navigators, we do all of the steps. So again, all we say is sign up and show up, and our navigators are going to take it from there. We're going to get you to the best location closest to your home, and again, provide ride services. Now, I also will share with you guys, this is very exciting news. It's brand new news, but Equal Hope is now a lead agency for the Illinois Breast and Cervical Cancer Program. That program in itself cuts down a lot of barriers. And with Equal Hope being a lead agency, we have cut out the middleman so we can provide direct Illinois breast cervical cancer services to all of the uninsured community. Also, that program, and it's referred to as IBCCP, the Illinois Breast and Cervical Cancer Program, also provides services to all of our sisters who are what we refer to as underinsured. What does it mean to be underinsured? It means that you have insurance, but your insurance does not cover preventive screenings. And for an example, I had a lady call me the other day from Southwest Airlines, guys. It's a Fortune 500 company, maybe a Fortune 1000 company, but they have health insurance, but their insurance does not cover preventive screening. So anyone that's employed by Southwest Airlines are considered underinsured. And we here at Equal Hope can address those issues. And we do every day. And we're here waiting for you to call us. If you don't have insurance or you're underinsured, you give us a call and we can make sure that you get all of those services that you not only need, but that you deserve. Oh, and you can visit us at equalhope.org. I did put my information in the chat. Thank you guys so much for allowing me to share this information.
Awesome. All right, so we're going to move on quickly to Dr. Velmier. All right, so I am very excited to hear about Lucero. It's one of the newer coalitions and collaborations that we have on the call today. So please tell us a little bit more.
Yeah, so kind of as I kind of mentioned in the initial intros, so basically we're kind of focused on increasing our outreach and presence within the Latino community surrounding the University of Chicago. So on the South side, kind of we do have a fairly significant number of Latino patients within our catchment area. Kind of extending down all the way probably to like Joliet and New Lenox areas, which we do have presence with the Cancer Center and like at Orland Park and everything. Some of the community events that we've been involved in have been primarily in the South Chicago neighborhood in the 60617 zip code area. And really kind of our involvement is really on the ground. We work to kind of facilitate education as well. So like I said, Erica, who's also here, will hold regular sessions in the community, either on Zoom or in person, of doing like a 101 on different types of cancer. So she's led sessions on HPV vaccination and cervical cancer awareness, breast cancer awareness, colon cancer. So she kind of does this like several times during the month. And just 2 weeks ago, I was in one of the events and partnering with the Centro Comunitario Juan Diego in South Chicago as well, kind of talking to patients at a community health event, kind of to raise awareness on breast cancer, about kind of breast cancer 101, screening 101, who should get screened, who should maybe have an increased awareness about getting screened earlier, because that's just as important, especially in the cases of hereditary breast cancers. So a lot of what we've done kind of has been in that arena of kind of educating and promoting research and our cancer center within the community, because I think we often, we have a catchment area that includes a lot of Latino patients, but we don't often see these patients in clinical trials. So ultimately the goal will be to kind of engage them more with, not just with our cancer center, but also with what a clinical trial is, how clinical trials work, what the purpose of a clinical trial is, and the potential benefits of seeking a cancer clinical trial when seeking cancer care.
Thank you. I probably will talk to you a little bit more offline about it. It's something that we think we can learn a lot from what you guys are doing. So, all right. So, Faith, can you tell us a little bit about the Faith Community Nursing Program you have at AMITA and how you've been successful in creating and implementing screening initiatives within this model?
Thanks. So yeah, so I do feel very grateful because AMITA Mercy, I think, is pretty unique in that they send me as a nurse into the African-American faith community where I can have more access to populations that I'm directly working with to promote health and wellness and give them the practical tools for healthy lifestyle change. So that's exciting that I'm able to have that opportunity. Now, as far as breast cancer is concerned, I think one of the things that that we've done to really attack that is I've collaborated with the health department to really understand, you know, what are the numbers, what's the need, what's the impact here? And I think that that has really helped to shape and to make it a more significant and to raise level of significance for this topic. So I didn't know that the impact and the incidence for breast cancer was equivalent for the other races, you know, in King County. But African-American women were dying 3 times more than Hispanics and 1.3 times more than Caucasians. So that gave us a really strong reason for action. What are we going to do? So thankfully, the American Cancer Society has really embraced us. And we just realized that we really needed to raise awareness amongst African-American women about the need to be screened. Every eligible woman needs to be screened. So we started really getting information about the Making Strides Against Breast Cancer Walk, because we really wanted to highlight and let the American Cancer Society know that we are serious about our health and our breast health. And so we wanted to have a good presence there. So we've been working to increase that. And the other thing is we started a Tag a Sister initiative, where it's a grassroots effort where women give their status and say, yes, I've been screened. So we want to get, you know, 200 women screened, saying that we've all been screened. But then you also have to tag another sister. And they give me that information so that I can send out reminders. They have to, you know, if they need reminders to get screened, because sometimes you're just busy. So I can just email you reminders. Or if there's a financial need, you need to be connected to resources. So it's very exciting. There's work to be done, but I think that from a grassroots perspective and approach, there's a lot that we can do. So thank you so much for this community conversation.
Thank you for being a part of it. That's really awesome. I'm glad that you're doing that hard on the ground work in Aurora. We always get Chicago centric, but it's still need other outside of Chicago. All right, so a couple questions for Ivy and Anna with the Chinatown Patient Navigation Program. Can you tell us more about how patient navigation is addressing barriers in the Chinatown community and what you all are doing to target the residents within Chinatown?
Yeah, I can take that one. So the other panelists here have done a great job of explaining the patient navigation model overall. But for our specific study, our patient navigators are bicultural and bilingual, which allows them to basically coordinate their patients in ways that are easily understood, as well as culturally sensitive to certain stigmas unique to the Chinese immigrant population. And so for us, by having a focus on the social determinants of health, the navigators are essentially a crucial puzzle piece that connects clinical health outcomes with all of the other factors that affect their health. including housing, insurance, food security, job security, intimate partner violence, and so on. And so during PN 1.0, for example, we spent a lot of time helping patients navigate the new Affordable Care Act policy and what that meant for their insurance status. And so this and other social determinants will also be a continued focus for PN 2.0 as well.
Awesome. And you know, you mentioned the bicultural and bilingual part. Now, how have you all been able to work with local health care providers and systems that don't have necessary translation and interpretation services available?
I'm sorry, could you repeat that again? Sorry.
No, I was just asking because you mentioned that how important it is for your patient navigators to be bicultural and bilingual. So many times when you work with your healthcare providers, they are not. So how important has it been for your patient navigators to provide that additional translational interpretation services to patients during the process?
Yeah, that's a great question. Thank you for asking that. That's a really important point of focus for us. Our navigators basically provide interpretation services and translated health information during either in-person clinical visits or in real time over the phone. And so a lot of the institutions or clinics that we work with actually do oftentimes have in-house interpreter lines, but many of our participants during the PN 1.0 program, including both patients and the clinical staff, express that our navigators not only significantly increase the efficiency of clinic visits compared to using the standard interpreter lines, but they also increase the trust between the patient and the healthcare system. And we see this as really primarily because the navigators essentially follow each patient from start to finish as they go through the entire treatment program, whether they start from the screening stage or they start from the radiology stage in terms of their point of entry into our program. And this allows the interpreter to really have a very clear understanding of the patient's past clinical history, as well as a clear idea of what's on the road ahead. And so that way they can account for and advocate for the patient needs as they go along with them on this process. And so I guess in that way, our translators really reduce the complexity of linguistic, cultural, and institutional barriers that our patients face.
Yeah, that's a very great point. And I want to open it up to the other panelists to kind of piggyback on what we were just talking about with Anna. So how do you create materials and information that targets the population that you are working with? So I'll actually start with Dr. Velmier, because I know you all have done a lot around that.
I'm sorry, can you repeat the question again? Sorry.
No, sure. How do you create like health educational materials and programming that is targeted to the population that you're working with?
Yeah, so that's a good question. I mean, I think it kind of starts at kind of understanding where people are coming from and what their background is. I think when I try to talk to the community, I kind of try to think of like what is the most important thing that I think people should kind of take from this and really stress that. So I think when I've had conversations with people in the community and have made different things in the community, I try to make it as kind of as plain as possible, something that's has good evidence behind it, guideline directed, but also putting it in a way that is very understandable and kind of simplified for patients to understand. For example, so I think the main gist of a discussion that I had with people in the community just a couple of weeks ago was when to get screening and to understand that not everybody is the same. So I think just highlighting that sometimes people for a variety of reasons have a higher risk of developing breast cancer, to take those things into account and making sure, and part of that also just involves like, if they don't know exactly what their risk might be to discuss with their doctor and to kind of really bring that up as a separate conversation. And I think that's really part of our effort more broadly. I think just so many patients, especially in the Latino community, don't often get to share all of their concerns or ask all of their questions because the doctor that they see doesn't speak their language. So they have to kind of economize what they're going to say, what they maybe give like one or two problems that might be on their mind. But when you have somebody who speaks your language and really can actually identify with, that's really when you can kind of, it's like their guard just comes down and they ask all the questions. The visit might end up being like over an hour long, but it's fine because you're helping them and kind of they're finally getting something off their chest that they've had on their mind other than like an acute issue. So I think that's really the way in terms of getting patients to engage with screening procedures and kind of catching a lot of these things early, because I think one of the issues with disparities is that we see a lot of disparities. Some of it is biologic. I think most of it is due to social determinants of health. So when you kind of have everybody on a level playing field and have everybody get screening appropriately and get things followed up in time as with everybody else, then you start to eliminate those disparities. So I think kind of, I think education is really laying the groundwork for that.
Totally agree. Totally agree. All right, so we have like 2 more minutes left. One final questions opening up to the group. So many of the programs and initiatives that you all have described, very much describe your work as being the bridge between the community and our healthcare providers. And so as that bridge, how have you all been able to increase the trust in the medical field and medical professionals? Because that's often an issue with minority populations. So Faith, I'll turn to you. I know you work with faith-based groups that often are not expecting to hear a medical message. So how have you been able to build that trust?
Okay, let me make sure I understand the question. You're asking about how do I connect medically?
How do you build the trust within the among your community members that you're working with to trust their health providers?
Okay. That's a really good question. So I think that part of it is looking at health providers are providing the practical resources that give them access. I think that that's really important. And I think that they know that they can tell which organizations are really community minded and are giving them the resources that they need. So that's been really good. So it's my job to really understand the resources that are available. So I really do a lot of networking within the community partners. And I think that that's a way that they gain their trust. They hear, they go to health fairs, they talk to people there, they see the events that different community organizations are doing. And I think that that's really helpful. Like right now, the health department has reached out to the congregations that I work with to hear, what's important to your health? What kind of programming do you want to see in this community? What helps you eat healthier? What helps you exercise more? So I think when they see the outreach that organizations are doing to them, that it's really impactful.
All right, so we're right at time. So I want to thank all of our panelists for joining us today for a community conversation. I believe ACS will share all the information that they've gathered from the chat box with you following this session. Please join us at the next session where we'll talk about some of the policy initiatives that are happening to reduce breast cancer disparities. Again, thank you for joining us and we'll see you later.
Thank you.